You've had another UTI. You take the antibiotics. It settles down. Then a few weeks later, or a few months later, the burning, urgency, and that horrible familiar feeling are back. So you do the same thing again. Another test, another prescription, another course of antibiotics. And eventually the obvious question becomes, why does this keep happening? The problem is that if every UTI is treated as a completely separate event, you may never find out. If yours keep coming back, it's time to stop looking only at this UTI and start looking at the pattern connecting all of them. Here's how. Part 1. Build the timeline. The first thing you need isn't another theory, it's a history. Go back through your previous episodes as far as you reasonably can and write down. When did the symptoms start? What were the symptoms? Was a urine test done? Was a culture done? What organism was found, if any? What antibiotic were you given? Did it work? How quickly? Did the symptoms disappear completely? And most importantly, how long was it before they came back? You don't need a beautiful spreadsheet. A notebook or document on your phone will do. What you're trying to create is something that's very difficult to see when you're dealing with one miserable episode at a time. A sequence. Because once you've got the sequence in front of you, you can start asking better questions. The book strongly recommends keeping previous results because recurrent episodes build a history. Organisms identified, treatment responses, and antibiotic sensitivities can become useful information rather than disappearing into separate consultations. Part 2. Ask whether it really went away. This is an important distinction. Did you recover completely and then develop another UTI later? Or did the symptoms improve but never quite disappear? Maybe you finished the antibiotics and felt 80% better. Then 3 days later, everything ramped up again. That's different from feeling completely normal for 3 months and suddenly developing a new infection. So don't just record. UTI, March. UTI, April. Record what happened between them. Did the first one genuinely resolve? Did symptoms linger? Did they disappear and return almost immediately? Was the same organism identified again? Did treatment produce the response you've previously come to expect? The book repeatedly emphasizes that the pattern is what matters, particularly when symptoms persist, fluctuate, return immediately, or stop responding in the way your previous infections did. That doesn't diagnose the cause, but it gives you a much better question to take into the consultation then. Why do I keep getting UTIs? Part 3. Look for what happened before each episode. Now look backwards from each infection. What happened in the day or two before the symptoms started? Don't decide what the cause is yet. Just look for repetition. Did symptoms repeatedly appear after sex? After periods when you weren't drinking normally? Around travel? Around changes in routine? Around hormonal changes? After delaying urination for long periods? After something else that appears repeatedly in your own history? One occurrence proves very little, but if the same thing appears before episode after episode, that's worth noticing and discussing. This is why a simple diary can be much more useful than trying to remember 6 months later. You're not trying to diagnose yourself, you're collecting information. And information gives you something you can actually test. Part 4. Keep the lab results. This one is ridiculously easy to overlook. Get copies of your urine results. Don't just remember, the doctor said it was positive. If a culture was done, keep the actual result. Because over several infections, those reports may start telling a story. Which bacteria were identified? Were the organisms the same or different? What were the bacterial counts? What did the sensitivity testing show? Which antibiotics were listed as sensitive? Which were resistant? And how does that compare with what actually happened when you took the treatment? The book makes the point that culture results shouldn't be reduced to simply positive or negative. They need to be considered alongside symptoms, timing, previous episodes, and treatment history. And when you're seeing a different doctor, traveling, using urgent care, or having an online consultation, you may be the only person in the room carrying that history with you. Part 5. Track the treatment, not just the infection. Write down the exact antibiotic, not those yellow tablets. The name, the dose if you have it, how long you took it, and what happened. Did symptoms start improving within the usual period? Did they improve slowly? Did nothing happen? Did everything disappear and then immediately return? Over time, you may discover that one treatment has repeatedly worked while another hasn't. That's useful information. It doesn't mean you decide which antibiotic you should be prescribed next. It means you can say, "I've had this repeatedly. Here's what was cultured previously, here's what I was prescribed, and here's what happened." That's a much better clinical conversation than everybody starting again from zero. The manuscript explicitly argues for bringing that accumulated experience into the consultation, clearly rather than confrontationally, because otherwise recurrent cases can repeatedly be treated as first presentations. Part 6. Notice when the pattern changes. Here's where things get particularly important. Suppose you know your usual pattern. Symptoms appear, you get tested. You receive treatment that has previously worked. Usually you improve, but this time you don't, or the symptoms fluctuate. Or two treatments that would normally help make very little difference. At that point, don't simply assume, "This must be an even worse UTI." The book specifically raises the possibility that persistent urinary symptoms aren't always being caused by infection alone. Bladder sensitivity, pelvic floor tension, hormonal changes, and local irritation can produce symptoms that overlap with UTI symptoms. That doesn't mean you decide which one you've got. It means the question changes. Instead of, "Which antibiotic next?" it may become, "Do we need to investigate why this isn't behaving like my usual infection?" That's a very different conversation. Part 7. Take the pattern to the doctor. Now put everything together. You don't need a 50-page medical dossier. One page can be enough. Dates, symptoms, culture results, organisms, antibiotics, response, time until recurrence, possible repeating triggers. Then you can walk into an appointment and say, "This isn't my first UTI. This is the pattern I've been seeing." Now you're not relying on memory while you're uncomfortable, frustrated, and trying to explain 6 infections in a 10-minute appointment. And you're not telling the doctor what the diagnosis is. You're giving them better information with which to investigate it. That's especially important with recurrent conditions, because fragmented care can mean that no single clinician has seen the entire sequence. The book describes exactly this problem. Even when records technically exist, previous responses and results aren't necessarily carried into every new consultation. Close. If your UTIs keep coming back, don't just keep asking, "How do I get rid of this one?" Start asking, "What happened last time? Did it completely resolve? How quickly did it return? What organism was found? What treatment worked? What didn't? What keeps happening before these episodes? And has the pattern changed?" You may not discover one neat cause, but you will stop treating every infection as though nothing happened before it. And that's the real shift. Because recurrent problems need history. They need patterns, and they need the next decision to be informed by what happened last time. Break free from recurrent. UTIs goes much deeper into testing, treatment, recurrence, prevention, and how to build a practical system around a problem that otherwise keeps knocking your life sideways.